Hey guys, welcome back to my channel, The ENT Resident. Today I'll be talking about the different signs that you can see in sigmoid sinus thrombosis. Now, as we talk about this, there are going to be three things we'll discuss over here. We'll talk about the delta sign, we'll talk about Griesinger sign, and we'll also talk about a typical pattern of fever that we see here, which is Picket fence fever. These are the three signs that we'll talk about today. And under each one of them, I'll be telling you what kind of a sign is this. Is this a clinical sign or a radiological sign? What is this sign? Is there any other name given to this sign? What condition do you see it in? What is the reason behind this sign forming? Why do we call it in this name exactly? And if there are any simple MCQ viva questions that could be there associated with it. So let's get started. So our first one over here, you can see that this is known as the delta sign. Now, as you can see from the image itself, this is a radiological sign that we usually see in a contrast enhanced CT or an MRI. Now, what is this sign? Let's try to describe this sign because that's how you'll actually have to do when you're sitting in your viva tables. How do you describe this sign? So, as you can see in a contrast enhanced CT scan or an MRI, we see a triangular filling defect. If you look at the image here, we are able to see a triangular filling defect within the dural venous sinus, and this is surrounded by this contrast enhancement. So essentially what we are seeing here is there is a central low density with a rim enhancement around it, a triangular rim enhancement around it. That is how you describe the delta sign. And as you can see in the image, it kind of looks like an empty triangle, right? Therefore, it is also known as empty triangle sign. Now, where do we see it? This is typically seen in lateral sinus thrombosis. Now, what is the reason behind this particular appearance? So, what happens in a contrast enhanced CT scan or an MRI done in lateral sinus thrombosis is the thrombosed venous sinus does not fill with contrast, and the surrounding dura which is there, it enhances normally. So the thrombosed sinus is this middle portion over here which you are not seeing to be enhanced at all. Because it is thrombosed venous sinus, it is not being able to fill up with the contrast. However, the dura around it is able to enhance normally. That leads to this typical finding where we are seeing a central non-enhancing triangular area which is basically indicating the thrombus, and it is surrounded by an enhancing dura which is giving this rim enhancement. So the central low density that we are seeing over here, this is the thrombus, and the rim enhancement that we are seeing is the normal enhancement of the dura. This gives rise to this delta sign or the empty triangle sign. And so I've told you that we see this in contrast enhanced CT and MRI. There is, if someone asked you specifically on what section of the scan do you see it in, then your answer would be that you would be able to see it in an axial cut, especially in the, if we had to go further in details, you will be seeing in the axial cut in the posterior cranial fossa. You can see this is the posterior cranial fossa region. So this is the reason behind the delta sign to be appearing like this. Now, why is this called delta sign? Now, this is called delta sign because, as I've just discussed, the typical appearance comes out to look like this triangle. Because of that reason, this looks like a delta. Therefore, it is known as delta sign. And because this is also looking like an empty triangle, this is also known as empty triangle sign. Now, the most common cause for just an MCQ question related to this, the most common cause of lateral sinus thrombosis is a case of CSOM with cholesteatoma. Now, associated with this is another sign that we see in lateral sinus thrombosis, and this sign is known as the Griesinger sign. Now, what is Griesinger sign? First of all, what kind of a sign is this? Griesinger sign is actually a clinical sign that we see when we are performing mastoid examination. So you can see this is the Griesinger sign. Now let's try to describe it. Griesinger sign is when there is edema of the post-auricular soft tissues and it is overlying the mastoid process area. And this possibly occurs as a result of thrombosis of a specific vein, which is the mastoid emissary vein. So Griesinger sign is basically happening because of thrombosis of mastoid emissary vein. We end up seeing edema of the post-auricular soft tissue which overlies the mastoid process. Now, what is the reason behind this? Now, in a case of normal mastoid, the mastoid area does not have any edema. In Griesinger sign, we are seeing that the edema develops and there's some tenderness over this area. This is because when the mastoid cells are involved in an infection, the infection spreads from the mastoid air cells and it leads to thrombosis of the mastoid emissary vein. And because there is thrombosis in the mastoid emissary vein now it has impeded the venous drainage. Now, because the venous drainage has been obstructed or impeded, this leads to venous congestion and edema to develop over the mastoid. And that gives rise to this particular sign, which is the Griesinger sign. As you can tell from the name, this is an eponym. This is a sign which was named after the first person who described it. Now, Griesinger was the person who described the mastoid region edema due to mastoid emissary vein thrombosis that occurs in sigmoid sinus thrombosis. And that's how this name comes in. Now, a very important part to remember here is which vein is involved. It is the mastoid emissary vein. And most common ENT cause again of lateral sinus thrombosis is a case of CSOM with cholesteatoma. That brings us to our last sign over here, which is picket fence fever. Now, as you can see in the image over here, this is what a picket fence looks like. Now, this fever pattern that we are seeing over here, this is a clinical sign that we are going to see in our patient. It depicts a typical pattern of the fever that we see in a case of lateral sinus thrombosis. How do you describe this pattern? Just like the picket fence over here that you can see, this refers to a characteristic fever pattern where we have spikes of high temperature separated by normal readings. Then again there is a high temperature peak. So you can see there are two high temperature peaks separated by near normal readings, and this resembles how a picket fence looks like. And that's the reason why this is known as picket fence fever. Now, let's try to understand what is the reason behind this particular fever pattern that occurs in lateral sinus thrombosis. Now, the typical feature in this pattern is that we see repeated spikes in the fever, and in between the repeated spikes, we are seeing normal or very low grade temperature. The reason behind this particular pattern is septicemia. Now, when there is septicemia happening, it coincides with release of septic emboli into the bloodstream. And this septic emboli is the reason why you are having these repeated spikes. So whenever there is a repeated release of septic emboli, there is a repeated spike and then it goes back to normal. Now, typically the patient here, they'll be having irregular fever, having one or more peaks in a day, and this fever will be accompanied by chills and rigors. And when there is a fall in temperature in this part, during this time, the patient will also have profuse sweating. And in between these bouts of fever, these are the two bouts of fever, right? In between these bouts of fever, the patient will be alert with a sense of well-being. And again, when the fever comes in, the patients will not be feeling well, and their consciousness level will change. And so this is typically what we see in picket fence fever, but it is not necessary that you will be seeing this in every single case of lateral sinus thrombosis. Patients who have started to receive antibiotics may not show this fever pattern at all. So that's about picket fence fever and the different signs that you can see in lateral sinus thrombosis. If you have any doubts regarding this, please note them down in the comment section and I'll get back to you. Thank you.